Hey listeners, want us to let you know when new episodes are available? Simply hit the subscribe or follow button on the Next Breast Thing podcast, wherever you listen to podcasts. Also, join the conversation on our Facebook group by searching the Next Breast Thing podcast group on Facebook.
On this episode of The Next Breast Thing,
we're about to do a home renovations.
Last time I talked about a new grandbaby, but I may have bigger news now.
I'm located in California, so a lot of what's going on in my life right now has to deal with the fire.
The role of integrative medicine in the care of breast patients.
When you guys talk about integrative medicine, what are we referring to here?
I just came across this definition that integrative oncology is
in our cancer center. We actually have a center for integrative care, and it includes.
But then there's also actual interventions like Susie mentioned, Reiki therapy.
What's happening in the community is a lot of people are just getting put on these GLP-1 analogs, and they're not getting.
I got fired by my meditation coach. I asked a simple question, which I thought was reasonable. I simply asked if I could...
This is Carla.
Ellie.
Michael.
Susie.
Sitcha.
And Susan. Welcome to The Next Breast Thing, a podcast by the American Society of Breast Surgeons for the entire breast community.
We're a group of devoted surgeons from different parts of the country,
inviting you to journey with us into the science of breast
through the heart and soul of our breast community.
From advances in procedures and patient care
to personal transformation, we're here to support you.
So, if you're part of the breast community and can't seem to find the answers, this is the next breast thing.
Our topic today is the role of integrative medicine in the care of breast patients. But before we get started, let's begin with some professional and personal updates. Carla, are you surviving winter in the Midwest?
Barely. I'm here, so excited to see all of you. But yeah, it was about 5 degrees today, so we'll see how long that lasts. We're about to do a home renovation, so I'm sure everybody can collectively sigh for that if you've been through it or know someone who's been through it. So we're in the fun process of picking out things. Haven't done any demo yet, but we're going to be moving out of our condo for a couple of months while it happens, so stay tuned.
I usually suggest doubling the time and increasing the price by about 30% of what the estimate was.
Well, that's why I was working over the holidays to pay for this. Susie, how about you? What updates do you have?
Carla, last time you had talked about how you sat down and wrote goals and reflected on that. And so my family, we did bingo. So we made these bingo cards and we just put random things in there. And so one of my goals is to make a good gluten-free bread because my daughter has celiac and that's something she really misses. It's not going so well so far. Like it's okay, but it's not that home run yet. Sitcha, tell me about what you've been up to.
Susie, we have somebody at work who makes everything gluten-free and brings it in for everyone. I can guarantee you it is possible to make it really good. I wanted to talk about a really awesome local regional conference that my hospital puts on that we just concluded. It was a lot of fun. I met great people. As you know, I'm at Rutgers Cancer Institute in New Brunswick, New Jersey. We're part of this RWJ Barnabas Health System. So it's, it's a whole network of hospitals throughout New Jersey. And I love that we have this annual Oncology Clinical Practice and Research Summit every year. We just concluded it. And it's just such a great way to showcase young talent within the organization and all the research efforts done throughout the network. A great way to collaborate with other breast surgeons and with oncology professionals. What about you, Ellie?
I'm located in California, so a lot of what's going on in my life right now has to deal with the fires. Although I'm about 40 miles away, still a lot of my friends have been evacuated, and so trying to lend them aid or help them navigate. They keep turning off power to our homes. That's another fun thing they do in California when they're worried about fire is they cut out power for days at a time. So we've been going through that. Today, luckily, we have our power, so that's great. But the silver lining of these big times in our history is you see the community and you see people supporting each other, coming out of the woodwork, offering places to stay. I think that's really beautiful. I was in New York City during COVID when that was happening as a resident, and it was a similar feeling. It was a very scary time, but I also saw the community reaching out and helping each other. And that is one of the most beautiful things I've ever experienced in my life, is seeing community come together, even in our world when it feels so divided at times. Michael, what about you? What's new with you?
Our thoughts from all over the country and even all over the world are with you guys. And it's not going to be a easy or quick recovery, but we are concerned about you and our thoughts are with you. Last time I talked about a new grandbaby, but I may have bigger news now. I think my cow is pregnant. I'm not really sure. I guess we could do an ultrasound, but I don't really know how to get the machine out there. But I have a cow, and I'm pretty sure that she's pregnant. So there's a lot of fertility happening around us in West Tennessee, and we're very excited about that. So it's just going great guns. Susan?
Congratulations.
My question is, how do you ultimately find out? Does the cow just deliver?
That very small cow will then appear with the herd, and you'll begin to think, that's probably my cow.
So we don't worry about prenatal care of the cow.
I got a guy, and I don't know, maybe he does. I've asked him all these questions, and I said, how do you know if the cow's pregnant? Well, she gets fat. So that's kind of what I'm holding on to. I'm just going to see if she gets fat. If that were the case, I would have been pregnant. So that's.
Do they have to pull the calf, usually?
I'm just going to report back the birth of the cow. I'm not going to, this isn't all the things great and small. I'm not going to be out there having to pull a cow out. I don't know how to do that.
How long is gestation?
I think it's long.
I don't know.
6 or 8 months. I think it's a long thing.
Is it? Does anyone
know? I have
know?
a cow. I'm not really a cow person. I just have a cow.
Okay, all right.
Was this an intended pregnancy for the cow?
It was actually, because there's like a bull out there with them. So we sort of anticipated this coming, and other small cows have appeared within the herd. So I think the bull is doing his job. Hopefully my female cow is part of that deal.
Oh, they have a 9-month gestation.
There we go. See?
Oh, it is long.
Human.
Yeah.
It is long.
Cute.
So do you pay more for the pregnant cow?
I paid for a cow hoping that she would get pregnant, and then we're thinking she will. And then you have what's called a cow-calf operation, where you sell off the calves.
You're selling your babies?
You sell them. I don't know. I may keep it, though. I may name the baby and keep it. I don't know.
All right. Well, given all this interesting information about the pregnant cow, why don't we move on to our topic, the role of integrative medicine in the care of breast patients. And it means something different to everyone, and really in every office and every cancer center. So, Susie, why don't you start and tell us how you all treat your cancer patients or breast patients in general with integrative medicine?
I'm based in Boulder, Colorado, and in our cancer center, we actually have a center for integrative care, and it includes Reiki, massage therapy, acupuncture is through there. And there's also a physician who leads an integrative care conference, and we've worked with board-certified naturopaths, and this is not a replacement. This is really to help mitigate side effects and help with general health and going through therapy. We know how important sleep is, and if that means that we are connecting with hypnosis or different adjuncts so that people can be successful with their treatment, it is so important. And sometimes this is in treatment, and other times it's survivorship. We all know our patients can have that letdown after they've had all that cancer and the treatment. They're just one foot in front of the other, and then they're like, oh, wow, all that just happened, and how we help reclaim that. And that's in addition to a lot of the other adjuncts that are offered. Carla, what's it like in the Midwest?
I think each hospital has different programs that they offer for patients. I don't know if I can speak for the entire Midwest, but I think there's people that do it well as a health system. And I think there's patients that are going out there and seeking out these treatments for themselves. I think before we dive even farther into it, I mean, how do you guys define integrative medicine? For our listeners out there who are doing this or thinking about doing it, because we throw this term out and I think it's kind of a catch-all term. So when you guys talk about integrative medicine, what are we referring to here?
That's an interesting question and honestly, integrative medicine is a newer one for me. I was always dealing with alternative medicine or complementary medicine, and that was easier for me to define to the patient. because I would say, look, alternative to me means that you're not going to really do what the standard of care is. But if there's complementary, then you're adding to it. You're still continuing on with what we're recommending. However, there may be some other things that are less traditional.
There's a whole field now of integrative oncology, and there's a society of integrative oncology. So there's integrative medicine, there's integrative oncology, which specifically focuses on cancer patients. And I just came across this definition that integrative oncology is patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and/or lifestyle modifications from different traditions alongside conventional cancer treatment, which is really important. So it's almost a blending of Eastern and Western medicine. But I think the important thing is it's the blending. It's not one or the other. And I think that there's enormous benefit when we look at it in that way.
I totally agree. I mean, this is about treating the whole patient, and it's about using a lot of different resources and pulling them together for the patient.
I think we're seeing more and more people utilize integrative medicine, alternative, complementary, et cetera. I think one of the challenging things is that it is such a broad topic. There's so many different ways to improve the holistic health of our patients, from lifestyle factors, dietary, stress reduction, sleep improvement. We start to talk about how important sleep is in cancer prevention and care as well. But then there's also actual interventions like Susie mentioned, Reiki therapy, meditation. Acupuncture is a big one that patients sometimes tap into.
Massage therapy also is enormous. When we use the term alternative medicine, that has such a negative connotation because we think of people going to a different country and getting treatment, as we discussed on this podcast early on, that just doesn't work. So I think integrative oncology is such a better term, or integrative medicine rather than alternative, because it's not a totally different field. You're still doing conventional treatment. Ellie, how do you think of this, and how do you employ this with your patients?
So, especially in California, the patients previously tended to sway on the spectrum of alternative medicine, even before going for conventional medicine. And the hospitals here had to basically adapt or die. They were either going to have to embrace this, or they were going to lose their patients to the acupuncturist or naturopath. And we're seeing it in my community. There are these centers that will take the patients if the hospitals are not on board. So at my personal hospital in Newport Beach, California, they've actually created Hogue for Her, and it's a center of wellness, and it has a sexual health therapist. It has Pilates. It has acupuncture, it has massage, and they're all very, very affordable. It's like $60 for a massage. They have couples therapy, personal therapy. They have dietitian services. One of my favorite parts of it is they have a health coach. So that's another thing I've noticed so many patients struggle with. Like, we know that obesity is linked with breast cancer, end of story, period. But what's happening in the community is a lot of people are just getting put on these GLP-1 analogs, and they're not given any tools to make long-term changes. So one of the aspects of our program is to have a health coach, to have a nutritionist, to have a personal trainer, all those things that help the patients make lifestyle choices, not just throwing a medicine at them and putting a Band-Aid on a bleeding wound. I think that's where integrative medicine is amazing. It's combining our knowledge of all of our evidence-based Western medicine with the fact that there's nothing better than diet and exercise, period. But it's hard for people to do it. And it's hard for people to understand why they're addicted to sugar and fast food and all the things that are in our society. So I think we owe it to our patients to give them this access. And it's hard to get approved at certain institutions, but it definitely is important for them to have a whole, complete experience and kind of become a whole person again after we have taken a part of them away in the surgery.
You know, showing that this integrative care really can reduce PTSD and depression, and whether it can be used during the therapy. And for some people, that's not the right time, or after the therapy, with survivorship and reclaiming is so important. And a lot of those things you touched on, especially sexuality and having that new interpretation. What does it mean to be me?
There's certainly a wealth of data supporting these approaches as well. There's randomized trials looking at mindfulness-based stress reduction, benefits with decreasing fatigue and depression, anxiety, fear of cancer recurrence, improved health-related quality of life on surveys. It can be effective for chronic pain. There's certainly a wealth of data supporting acupuncture for chemotherapy-induced peripheral neuropathy. A lot of our patients do have hot flashes and insomnia related to endocrine therapies, and holistic approaches could be really helpful for those as well.
There have been so many great points that have been raised, and two issues come to mind. Number one, Ellie, you touched on exercise. And there's a whole new field of exercise oncology. And this is one of my pet peeves, of which you'll learn that there's many. But someone comes in and they have high blood pressure, and they're given a medication, a very specific medication at a very specific dose, and told to take it once a day, twice a day, whatever it is. And then they come back for follow-up. And what do we tell our patients? Exercise. We don't tell them how to exercise or how often to exercise or what to do. And we're taking people that may or may not have knowledge of that and just saying that one word, exercise. It's hard to figure that out. And I think that all of us have to become more prescriptive when we say exercise. We can't take someone who's 75 years old and never exercised and tell them to exercise the same way we tell someone who's 30 years old and does triathlons. So we have to, as a community, figure that out. And the second question is, there are several of you that are way younger than me, but in medical school, I learned nothing of this field. And we're surgeons, so we learn about surgery during our training. So step one is, how do we educate ourselves? Carla, when you hear this, and I know you're interested in it, how do you educate yourself in order to educate others, specifically patients?
Yeah, that's a great question. I think it also highlights what data we have in this field, and we've covered a lot of different things. And I think that one of the first things I remember reading about that was data-driven was acupuncture for women on endocrine therapy blockers. And we felt really excited about this because we thought we could get more support. And I bet, a lot of you have acupuncturists in your cancer centers, but some of this other stuff that we're talking about, we don't have as much data there. And so I definitely first go to the journals and look for the randomized controlled trials as much as possible to be able to support that. A prescription for exercise, I don't know. We currently have a couple clinical trials in this area for exercise vibration therapy for women on AIs, and then also women getting chemotherapy. I think one of you brought up peripheral neuropathy. And so I think that, just like we talked about, this is not a new field, but a new field that we're talking about. I think the data that we're trying to gather on it is happening right now. So that's really exciting. But the support for it and the evidence behind it's a little bit harder. And so I would also circle back to what Ellie talked about. I always put on my business hat, and I know several of us have that, but how do you pay for this stuff? Offering services for a population for $60 might seem like it's accessible, but we all know that for many of our patients, it's not accessible. And so how do they work at your places? Are patients paying for a lot of this stuff that's being offered at the cancer center? Is the cancer center eating that cost per se? And do you think that with more data, that's going to get easier?
At our institution, some of it can run through insurance, and we also have an amazing foundation that supports that, because we really want everyone to have access to completing therapy and to have these opportunities if that's what's needed. So that's how we do it in our area.
You bring up a really great point, Carla, and it's great to have grant support and hospital and institutional support for that. But I think that brings up some of the barriers in access and disparities in care as well, because a lot of this is evidence-based and yet not affordable and not covered by traditional insurance. I have a friend who's a functional medicine specialist, and we go back and forth about this all the time. She offers vitamin C infusions at $500, I believe, per session. Don't quote me on those prices. That's expensive. Even just as a personal anecdote, when I was going through the IVF process, I was told that laser acupuncture pre-embryo transplant increases the possibility of a successful pregnancy. And of course, that's what I was seeking. And I think I paid $250 out of pocket for that. And it was worth it to me, but that's really just not affordable for everybody. So especially these scientific and data-driven aspects of integrative medicine, I think that's something of concern. The cost issue is one of my reservations. And the second is I have heard stories of people grasping onto options of things like vitamin C, or iodine treatment is something I just heard of recently, or other aspects, stress relief, avoiding sugar altogether, and holding on to that as cancer treatment. And while I think that integrative is the appropriate word, and I think Susan mentioned it really does need to be in conjunction with modern medicine as well. I had a conversation recently with someone where I said, what I worry about is the delays to conventional treatment that we're seeing based on desires to try other holistic approaches. Significant delays, years. I worry about that also. I think that when we talk to patients about this, we do need to be better educated and better equipped to have those discussions of what the role actually is, what is evidence-based, where there's a complementary nature, and just how important some of the conventional treatments are, of course, as well. So I do worry about delays to conventional therapy, sometimes for patients seeking alternative approaches. And then I also worry about the cost.
Let me play devil's advocate, though. How much of this stuff
You play that role well.
Well,
let's face it.
I mean, Carla keeps bringing up a good point that there is some data, and I'm willing to accept some of this, but some of this may be just marketing. Do we really believe that this stuff works? Maybe some of it does, but I think before we jump in the deep end on some of this stuff, that we need to really have more evidence that it's reliable.
I think there's a lot with that, though. But I think when you go for the target of, are we helping managing side effects? Are we looking at general health? I think those are really important. If that gets someone to complete treatment, absolutely there's value to that. If you're saying an alternative is in replacement, I think that's different than what integrative care truly is. We're looking at the whole person and helping them feel whole, and that we're along their side. This is not in replacement of something. And I think there's a lot of evidence, like if people sleep better, if there's less depression, we're going to be more successful.
And even if we're talking about general side effects, if you can reduce nausea and vomiting with some chemotherapeutic agents by the use of acupuncture as opposed to medication, why not? Why would you rather use medication to control a side effect of medication? I would want the acupuncture all day long. So I think going back to what Susie said, it's what is the endpoint that you're looking at? I don't think any of us on this podcast believe that acupuncture or massage will cure cancer. That's not the end goal. And if you look at the studies, that's not the primary endpoint. The primary endpoint frequently is quality of life and control of side effects that the medication or treatments that we've prescribed are giving the patients. So I think, Michael, I get you're playing devil's advocate and you don't really believe everything you just said. I have to believe that. So please tell me that's true.
No, I agree with you. But I think you got to understand that there are a whole bunch of listeners here that are thinking, come on, guys. We don't learn any of this in medical school. This is not part of our training. It's developed out where Ellie is in California, and it's trickled out here because it got popular, and there's very little merit for it. And I don't agree with that. We can't just jump onto this bandwagon and ride it and assume that there's not reasonable pushback.
Also asking, what is it you're looking for? I may not have learned that in medical school. I don't know what that is, but what is it? I'm curious. And I think even spending that extra few minutes being curious with a patient goes a long way, because You're showing trust in their thought process. You may not agree, but you're willing to listen, and they're much more likely to take the ride with you.
It's important to point out that this is a really, really, really broad topic. And I think it's great that we're talking about it. And I'm really interested to hear what our listeners kind of latch onto and are kind of more interested to hear about. But to really get into this is to really dissect out prevention of cancer, prevention of breast cancer, specifically what Susan said in terms of management of side effects is a great category kind of during treatment. And then you've also got the long term. We've talked a lot on this podcast about survivorship, which we know is a huge deal for our breast cancer patients. I would argue that diet and exercise are probably important throughout that whole continuum, but there's different roles of diet and exercise during all three of those periods for our patients. And so we could probably dissect into just one of those, getting your cancer treatment just after having surgery. What kind of exercises do you go over with your patients, which probably isn't integrative oncology, but just kind of talking about it, I think it's important to recognize that we're covering such a big area here.
I think you raise great points in that there's different reasons why we use this care. And again, remember, back to some of these points, there are many clinical trials. This is evidence-based. NCCN recommends acupuncture for pain, fatigue, nausea, vomiting, and hot flushes. So this is definitely evidence-based. Now, if you can use it for marketing, if your competitors do not offer integrative oncology and you do, more power to you. Use it. Putting on our business hats, as Carla would say, that's important. That sets you apart then from your competition because you're offering well-rounded care for your patients. And I think that's incredibly important.
If there's one thing that you would recommend to your patients that might fall into integrative oncology, what would be your biggest recommendation?
I would love to see people enroll in more clinical trials on integrative medicine. I'd love to see us gather more data. There's definitely data confirming that patients diagnosed with cancer do have a higher stress level. And if we can help people manage that, we contribute better to their overall well-being.
I'm less interested really in the after the fact than the before the fact. And there clearly is a problem in obesity in this country. To me, it's more important, what are the causes? Why are we sick? We do a pretty good job of treating the cancer once it develops, but what can we do maybe on the front end of that? And I don't know if that's integrative care, but what can we do in our diet? What can we do in our lifestyle that maybe gets to the point where the breast cancer rate's not 1 in 8? That to me is much more interesting. It's a much bigger question. It's hard to do in this country, but that's the question that really interests me the most from this topic. Ellie, I'm kind of interested to hear, because you're really in the middle of all of this. So tell me what it's like for you in California.
I basically have to be updated on this stuff because my patients demand it and they know so much about all these things that I've never heard of. So back to Susan's point where she's like, where do you guys learn about this? Because it wasn't taught in medical school. It wasn't taught in residency. It wasn't taught in fellowship. So I actually have to spend a lot of time trying to find reputable sources. And I get a lot of it from very highly followed PhDs that are neuroscientists that have huge labs coming out of Stanford. And they do go through a lot of these topics and kind of break them down into digestible pieces. So I honestly learn a lot from consuming their podcasts. It teaches me a lot and it's very granular. It's in medical speak and they're all evidence-based things that these guys are talking about. And I also consume a lot of books in my free time, but my patient population demands that I am up to date on all of this. So I don't know that I would be as versed in it if I was practicing in the Midwest or in the South, honestly. But the evidence that I wanted to mention is the impact of meditation. We have a trial on that at my hospital, actually looking at patients who we teach to do meditation before they get their mastectomy or lumpectomy. And we look at their pain levels. after. And we see the patients who had the surgery and didn't meditate and the patients who did. And the global data that we've gotten so far is the patients who learn to meditate, they learn some mindfulness, they have less pain. What a concept. If you could lower somebody's pain by teaching them how to breathe and take 10 minutes to themselves, like, wouldn't that be amazing? Just like Susan was saying for the acupuncture. Wouldn't that be amazing if we could use less medication to help our patients? I'm constantly trying to check, what have the randomized controlled trials said? They're just starting to do trials for women with intermittent fasting or with muscle building. You know, all of these trials previously were done in men. So the data is just emerging. So it really is on us to continue to educate ourselves and try to find the reputable sources. Meditation. I do it every day now. I initially was doing it before the OR when I was just so nervous as a new surgeon. And I forced myself to, go through a meditation course because I couldn't sit still. They were just like, that's fine. You sit there and you just focus on your breath. And then you go back and then you get distracted and then you go back and you get distracted. And I notice when I don't do it, my fuse is short. But when I do it, my fuse is so much longer. And I'm a much nicer person.
So Ellie, I'm sitting here laughing as you're talking about meditation, not because I think it's a funny topic, but I think meditation is so important. I went to learn how to meditate because it's not something that comes naturally. And I got fired by my meditation coach.
Oh, no.
He might have told me that I was not worthy of meditation, which I don't think anyone else in the history of trying to learn to meditate has been fired. I asked a simple question, which I thought was reasonable. I simply asked if I could meditate while I drive.
Driver, step out of the vehicle.
That infuriated him, and he told me I wasn't worthy and I needed to leave his class immediately. I don't know anyone else who's been fired by their meditation coach, but I kept at it and I went back, and I love meditation. I think it's life-altering. So as we wrap up, I have to say I always learn from each of you. So let's go around and just state one thing that we'll do differently as a result of this podcast as we go back to taking care of patients tomorrow. What will you do differently? Michael?
I think we owe it to our patients to explore alternatives. And this is a burgeoning field. I mean, it's kind of hot right now. For us just to stick our head in the sand like I have been comfortably doing for a long time, it doesn't do anybody a service. And yes, my patients are not clamoring for this like we see in California, but it's coming. And I think if we get out ahead of it, it's going to be much smarter for me.
Citra, how will you do something differently tomorrow?
Yeah, I liked something that Ellie said was just that we owe it to ourselves and our patients to read more about it. And so I'm glad we're talking about it. I'm glad this is an overview of our thoughts on the field. I'm a data-driven person, and I definitely want to learn more.
Susie, I've crowned you as our resident expert on this. So I'm not sure you've learned anything from us, but we certainly have learned a lot from you. So
I think there's always a lot to learn, and I think the openness, and I don't regularly ask my patients, would you like to be presented at the Integrative Care Conference, where we're pulling this team together of oncology, radiation oncology, naturopaths? Do you want to be presented there? Is that something that helps you through this journey? And I think just asking. Carla, what about you?
I liked Susan's comments about being prescriptive. I'm a pretty black and white individual, and I do think patients respond to specific direction in terms of things to do that we're recommending. I think prescription for exercise is very nuanced, so I'm not going to go there, but I agree with what others have said, and I think the role of mindfulness and meditation, both in our personal but also for our patients' lives, is crucial. So I think being a little bit prescriptive about what I'll recommend or suggest to patients in that realm will be different.
Ellie?
Actually, what you just said there, like in Susie, the integrative conference, I certainly haven't seen anything like that. Like, what a great idea to present a patient after their treatment and get the whole group together and think about what you could do next for them. That's such a big idea. I haven't ever heard of that or thought of that. And I think patients would love that, especially the ones that are seeking this kind of care.
Well, believe it or not, we're out of time again. But I'm guessing this won't be the last time we'll be talking about integrative medicine on the Next Breast Thing podcast. To our listeners throughout the breast community, we're so excited you've joined us on this journey, and we'll see you next time on the Next Breast Thing podcast.
We look forward to connecting with you on the next episode of The Next Breast Thing, a podcast by the American Society of Breast Surgeons for the breast community.
Join the conversation on our Facebook group by searching the Next Breast Thing podcast group on Facebook.
Finally, the content within the Next Breast Thing podcast represents the views, thoughts, and opinions of the co-host and may not necessarily reflect the views, thoughts, and opinions of the American Society of Breast Surgeons.
Until next time, this is Carla,
Ellie.
Michael.
Susie.
Sitcha.
And Susan. And always remember, if you're part of the breast community and can't seem to find the answers, this is the Next Breast Thing.